So tell me a little bit about yourself, Mr. Macy. Like what happened with your leg several months ago?
Shortly after my wife died in December, I had two swellings come out on the side of this leg. And I went to the local hospital and they inspected it, and they told me that this was poison come from some plants. In other words, as a gardener, I had not protected my legs from anything. I didn't expect anything, and evidently there's some poison in some plants that finally got to me because I'd been planting in that garden for 50 years. So then Cason's husband came up and took me down here, and we had a nurse come in and do the surgery to take all the poison out of my leg, which was roughly from my knee down to my ankle. I think it was, I never saw the incision, so I don't know what it looked like, but it was fairly big, I guess. And from then on, I had regular attention to the surgery, and until it's now down to a leaky, I haven't seen it, but I think there's a tiny leak somewhere down near the ankle. And when that's healed, I should be able to walk completely. Having to learn how to walk again is really a difficult procedure for me, because I ran, and I mean right up until the day before I went down with the injury, I was running, say, half a mile or a mile every day. If not, I was walking at least a mile. And I've been a walker or runner for many, many years. I ran the Boston Marathon in 1960, and it was very difficult for me to learn to walk and run again, and I haven't run yet. I still don't have my balance. And that's where I am. I can walk, mainly with help, but I can walk without it too. And I'm beginning to go up and down stairs and stuff like that. But it's a really surprise to a person that does an awful lot of running, not be able to run and not being able to even walk. I had to learn to walk again, and that's very difficult. Otherwise, the care has been absolutely superb. I'm probably right now the cleanest person in New York. I enjoy it. I enjoy it, but I don't like not being able to wash dishes and dry and cook and do all that stuff. I don't like to be idle. I think everybody knows that. And that's essentially where I am. I'm having a nice sort of blessing having Paul with me, who seems to be very competent, and everybody else is taking care of me. I like it, but I'd rather I was doing the work myself.
Can I ask you a question, Mr. Macy? Can I ask you a question? What did you think about how they treated you in the hospital?
Having what?
What was your experience, and what did you think about how they treated you in the hospital when you first went to the hospital?
I didn't hear you. I can't
It's okay.
As you
What did you think about how they treated you in the hospital when you were there several months ago?
Hospital, my thought was they didn't have the slightest idea what was wrong.
Okay, that's an honest answer. Now, what do you think happened? Why did you think you got better? What do you think happened that you were able to get better? So
I think Jeremy's husband made a decision to pick me up and bring me here and have it really attended to. And it turns out that there was a serious infection, and I don't think they knew how to treat it. In fact, this is no insult to the visiting nurse, but they thought I had a couple of things, and the last nurse I had said in a couple of days I'd be fully back to full health, and it didn't turn out that way.
I understand.
And the visiting nurses now are very attentive to the condition, and I think the condition seems to me to be relatively simple. I saw a picture of it, and there was a long sort of scar with a drip in it, and I think they know how to treat that. So I'm probably getting first-class treatment nowadays.
That's amazing. Is it okay if I talk to your daughter, Mr. Macy?
My daughter?
Yeah.
Yeah.
She's just, I'm speechless with regard to how much affection I'm getting. I don't think I'm entitled to it. It's just so delightful. And I don't know how you can repay the affection that I felt from both my daughters and for people around me. It's been very difficult for me to accept.
Thank you, Peter.
I like it, but it's difficult.
That's amazing, Peter. Thank you so much for sharing.